Alright, good morning, ladies and gentlemen. I'm going to go ahead and try this streaming thing and get into studying today. So I'm just focusing on reviewing old missed questions and some of the high yield stuff. This is based on the missed questions that I've tagged from questions that I've been doing in like UWorld and in Osmosis and some other resources, and then also the high yield stuff is just based on the Anki tags that are tagged as high yield. So I'm just gonna go ahead and rebuild some of these decks. There's also some Spanish mixed in here too, because I'm trying to stay up to date with my Espanol. In fact, actually, the first couple cards might all be in Spanish. So let's see. Steroid use. Okay, seating. Containment. Fecal and urinary incontinence. Ulcerative colitis? No. Crohn's disease? IBD. Alright, it's like both. Amino acids. Proper paddock. Herpes simplex virus of keratinocytes. HPV. I don't know why it's HSV. HPV 1. Thiazine? Methimazole. Alright, there's PTU and there's methimazole. See, this is part of the problem, is I don't know how to pronounce all these drugs. So we need to put a little sound clip in there so I can know how to pronounce it.
Methimazole.
Methimazole. I-bands and H-bands. Enzyme replacement therapy for Hurler disease? No, glucocerebrosidase. Niemann-Pick? I'm sure. Niemann-Pick is sphingomyelin. MEM1 is parathyroids, pituitary, pancreas. Agranulocytosis. Those are the two I just mentioned. PTU and methimazole. Methimazole. 6 weeks? Wait. So sometimes I don't even pay attention and like know what the question's trying to ask. Lower abdomen. Robertsonian translocation. Actin filaments. SOS sign. No. Oh no, that's right. It increases. Pain, preeclampsia. The Gibson's capsule gets bigger or something like that. Liver swelling, yeah. These inhibitors may cause a direct increase in bradykinin. Ooh, obturator sign. Pancreatic tissue. ATP. Blood and lymphocytes. Gastric, no, gastric, right after gastric. I think I'm from the proper gastric water. Nope. I think I would know this. This particular branch of arterial vasculature has been throwing me through a loop since anatomy of last year. So basically a year now, this particular diagram has been ruining my life. Cyclic fibrocystic changes. Afligido. IPs, cleft palate. Okay. And polycystic kidney disease. Salpicar. Salpicar means to like splash. No, early. Acostar. Cantar. Membranous nephropathy is characterized by epithelium. Despertar. Luteinizing hormone? No. Estrogen and androgens. High riding? Laryngopapillomas are found on true vocal cords. Dudar. Hyperaldosteronism, hypokalemia, hypernatremia. Las entrañas. It's like the
Entrañas.
Pembrolizumab. Acampar. Diplopia santos. Disease. ATP17 on chromosomes 16 or 13. I think it's 16. 13. I'm trying really hard not to swear. To keep this PG friendly for the stream. Acampar. Oaf, abductor, opponus, polis. Betad. Gerotoxin. Pesas.
Las pesas.
Las pesas. Schwanzels. Las hadas. It's like the fairies.
Las hadas.
Mucin. Glandular pattern. But there is mucin in there. Ectopic pregnancy. El Baul. One complication associated with lung cancer is pleural effusion, which is classically seen with pancreatitis, adenocarcinoma, associated with lung cancer, which is classically seen. Okay, well, pancreatitis can cause ARDS, but that's a totally different thing, I guess. Ligada. Chyliocytes have characteristic perinuclear halos. Obtener. Llenar. To fill. With democlocycline or vaptins, the aptins. Tolvaptan, convaptan. What is the cause of normal anti-GAP metabolic acidosis? As was remembered with heart. Acetazolamide? Calcium. You'd think as a biochem major I'd remember this stuff, but for some reason it always goes out of my head. Calcium to DAG. Number one, baby. Type 1. Polyhydramino. Polyhydraminose. See, y'all make fun of me, but learning medicine's like learning a brand new language, so give me some slack. Clostridium perfringens. Or Neisseria gonorrhea. Intrinsic factor. Dermal fibroblasts. Ooh, antagonist. Insulin. Overload. Left gastric. Pancreoduodenal. Right gastric. again, the same vasculature continues to ruin my life. Fast to fast now. Yes. Let's see. Cataracts. To pain. Gonadal atrophy. Mucosal and skin. Type 1. No, type 3. It's like the 5th day in a row I've gotten that card wrong. Yeah, now it's a leech. Leech. Lateral MI is AVL. The inferior is right coronary artery. I don't know. Glands. Mucus glands. Greater than. The gastric artery. Superficial inguinal. Von is all about von Willebrand factor, which normally stabilizes factor 8, but so factor 8 has a shorter half-life, thus making it harder to form clots and making it hypercoagulable. Bernard-Solier syndrome is all about 2 glycoproteins 1 and 2 not being able to adhere. I don't remember if it's glycoprotein 1 or glycoprotein 2, but they make it so that it can. GP1. Okay, eosinophilia and keratinocytes and the location. Cytoplasmic, eosinophilic, cytoplasmic keratinocytes. The mens of a patient, right? They get hurt and it's irregular. Yeah, menorrhagia, dysmenorrhagia. High and hot. Sulfa, it's a sulfa drug. Sulfasalazine. You know what? We're making a sound. Because I can't pronounce that word. And I don't want to have to present one day and sound like a dummy who can't pronounce his pharmacology.
Sulfasalazine.
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 Erythropoietin is a hormone that supplies kidneys in response to hypoxemia. Immunocompromised, like AIDS patients, you don't really get this unless you have no immune system. Splenic? Let's go. Glucagon. Type 3. Bradycardia. Avoid hyperplasia. CD40 ligand. My immunology is trash, and I will need to sit down and literally learn it all in one day to understand this stuff, because I don't get it in the slightest. Contratar. Chicken. Steroids. Well, pregnancy. Toxoid. Pregnancy. Second and third lumbricals.
¿Cada cuánto tiempo toma este medicamento?
Ocurrir.
Ocurrir.
Atesorar.
Atesorar. Irrumpir. Irrumpir.
Irrumpir. Berrinche. It's like
Berrinche.
Baby fit. El pecho
El
is a test.
¿Cuán a menudo lo siente?
How long have you felt it? Desquiciado. That means like, desquiciado is like, oh man, I can't really describe this.
Desquiciado.
Desquiciado. Plantear.
Plantear.
Renunciar.
Renunciar.
Soportar.
Soportar.
Intolerante. Los ancianos. Estancamiento.
Estancamiento.
Ilusionado.
Ilusionar.
Diseñar.
Dis.
El brazo.
El pezón.
El pezón. Más abajo.
Más
Porto o Sparta. Toxicity. Sorry about that, folks. I just realized that I was on the wrong profile. I recently switched over to using the Anki hub, and I used 2 different profiles to back all that up. And I just now realized I've been studying yesterday's material because my other profile was synced to had not been synced since yesterday. So it's fine. We're gonna go ahead and get back into this. One moment. And we're back. Just need Celsius, and my clicker was charging, and so now that's working, which is good. Alright. Now these cards I really should know. Droid key. Right ventricular. Classic galactus. Estrogen. Oh, herpes zoster ophthalmicus. X-linked cerebroplastic anemia. Straight. And people affected. population at risk. Patients with renal insufficiency have increased risk of metformin due to metformin population that thus decrease serum creatinine. Basically, if you already know that the mom has it, it's like if she had a previous infection or she tested positive already. History of GPS, current or prior child, a prior child. Okay. Glycosylation or sulfation. Look at me just making up words. Marinium. Sympathetic abscess. Parasite? Perforated door. Okay. Or subhepatic. Duh. Acute cholecystitis, but also heard from a pancreatic. From a perforated ulcers. First transcriptase inhibitors prevent transcription of double-stranded DNA to single-stranded RNA? No, other way around, because it's the reverse. It's literally in the name. In males, prolactinoma presents when the second rate decreased. Sorry, I keep looking over here because that's where my stream is, so I'm like checking to see if I look okay. I don't know. Should I talk to the camera more? I wonder if I like look down here to look at the card and then look up. Maybe that's a better way to present. I don't know. According to fixed principle, this is oxygen consumption over oxygen in the vein minus oxygen in the oxygen in the artery minus oxygen in the vein. There we go. See, I know things. Mortality rate measures the likelihood of specific disease of the population and risk of the population. Speed of death. Oh, central pontine central pontine spine symptomolysis. Central pontine myelinolysis. Osmotic analysis. I'm giving myself that one. Fecal oral. Case control studies useful for measuring neither. Decreased in hyper AG&E. Strongyloides is larva in the O&P. There is keratinosis, dermal hyperplasia, vacuolization in the cytoplasm, and lymphocyte. Dermal hyperplasia, thickened strand form. Okay, I'm giving myself that one. Preferred viscous may present with rich gas outlined. Regular sign. Leydig. Oh my god, Leydig. And what's the other kind? Serotoli. Leydig serotoli. What is the other? Ipex is also most sensitive. Excellent. Ipex. There's an X in the name. Should know that. Suddenly persons. Is pancreatitis perforated peptic ulcer? don't know why I have the idea of pancreatitis causing ARDS in my head right now, but I keep thinking that. Vitamin E can enhance the anticoagulant effects of warfarin. Oh, the reflux, the visceral urethral reflux. The patient's blank. This may reveal evidence of reticulocytes, spherocytes, and hemolytic anemia. Which type of stomach carcinoma are nitrosamines related to? Intestinal something carcinoma. Intestinal stomach carcinoma. Yeah, okay. Galactose 1-phosphate is ultimately converted to glucose 1-phosphate via the enzyme. It's not GALT, is it? Yeah. GAL1P uridyl transferase. Epic syndrome. Oh, I always got this question wrong. Especially atopic dermatitis. No, especially autoimmune alopecia. Intravascular hemorrhage is a CNS complication associated with NRDS patients. Supplemental O2. If someone has neutropenic fever, immediately start giving them. Oh, you give them anti-pseudomonal, like cefepime? Yeah. Perinuclear, dorsal medial nucleus, and thalamus. Propionyl-CoA is converted to. What is propionyl-CoA? Propionyl-CoA is converted to. Biochem. Why do I not know you? Methanoyl-CoA deficiency is an inherited defect in transport of long-chain fatty acids into mitochondria. Primary carnitine. What is the inheritance of classic lactosemia? Autosomal recessive. Incidence rate. Percent of new cases. Is the likely diagnose? Is this high serum osmolality? Is this SIADH? No, literally the complete opposite. Okay. Diabetes insipidus. The preganglionic neurons of AS have cell bodies in the central fibromas. Cutaneous neurofibromas. Temperature change? Yeah, high temperature. Orgasmic disorders. Loss of pain and temperature. Malignant intraepithelial adenocarcinoma. You should know that one. I've seen that card like 5 times already. Relaxation of the internal anal sphincter, contraction of the rectum. 1 alpha chain, 2 1 alpha something, 2 hela something, 2 hela something, 1 alpha something. 2 alpha, 1 chains, 1 alpha, 2 chains. 2 chains. What is the next step? Is it radiation? No, continuous loperamide. Mm. Internal carotid artery to the ophthalmic artery.
Despertar.
Despertar. To wake up. The pancreatic classic terms in. Remember using mnemonic fat RN. Thrombolytic thrombocytopenia. Aortic stenosis may present with syncope and dyspnea. Angina.
Las pesas. Las pesas.
Las pesas. Las pesas is like the weights. Ugh. A band.
El baúl.
El baúl. Cartilage. Perianal genital. The sciatic nerve. Normal. Decreased. They're normal with pregnancy and OCP. Internal carotid? Yes. Chloride channels. Abduct. Muscles of thenar eminence. Oh, flexor pollicis brevis. Oh, and the music is off. What's up with that? Why are we not keeping that going? Stand by, everybody. My apologies.
I said empty your.
Autonomic and something. Peripheral neuropathy. Growth factor stimulates the mind to produce agitated liver. Wilson disease is due to mutations in the ATP double gap. Sorry about the connection issue, everybody. Hepatitis is associated with Mallory bodies. Damaged. Ooh, intermediate forms? Yes. Hyperaldosteronism causes metabolic alkalosis. Aplasia cutis. Increased. Tetralogy of Fuller results in patients with early cyanosis.
Possession.
Defense. Bostezar.
Bostezar.
El resfriado.
El resfriado. There's another word for it too. But I forget it. Treatment. Practice. Scrotum and testes. Oh no. My brain is all over the place. Hormones that stimulate gastric acid. Gastric. Enzymes, fibromyalinases, deficient in Niemann-Pick disease. Systemic vascular resistance. Convert to dopamine via the enzyme dopa decarboxylase. Raising the cutoff point for a disease, the blanket will decrease the sensitivity and MPV. Parathyroid causes parathyroid hormones can mess with your calcium, phosphate, and increase bone reabsorption, renal calcium reabsorption, renal phosphate wasting. Alright, because you're breaking down the bone and you're bringing in more calcium to reabsorb, and then you're letting go of the phosphorus. Yes. Is it calcitonin? I think is the only one that like hangs on to the phosphorus. I don't know. Don't quote me on that. And tonsils and the medulla. Oh, that's not good. Majority of cases of Rett syndrome are caused by de novo mutations in CP43, some kind of gene. MECP2. Activated regulatory cells. Treg. What activates Treg cells? Let's. Interleukin 10. Interleukin 10. 10 is like relax, chill out. The assessment of decision making, a patient should be able to understand a choice, communicate a choice, understand information. If only I kept reading the rest of the question, I would have known that understand information was the next thing. Alright. Femur, long bone, like a femur, or tibia. Oh, C5 to like, no, T1 to L2, T5 to L2. Commonly caused by translocation of PCR and ABL. Epinephrine. Acetylcholine is foot processes. Spinal artery? Pollution of the anterior spinal artery. Something to do with the cerebellum and all that stuff. How can we know stuff like Further expansion of the CAG occurs during spermatogenesis. Apple bottom genes. Fusion of basal ganglia. Connections.
I said, empty your mind. Be formless, shapeless, like water. Now, you put water into a cup.
Severe.
It becomes the cup. You put water into a bottle, it becomes the bottle. You put it in a teapot, it becomes the teapot. Now, water can flow, or it can crash.
Low bar, upper low bar.
Be water, my friend.
Ooh, I do this. Galactosemia? No. Osmosis during parasympathetic.
I said, empty your mind. Be formless, shapeless. Be water, my friend.
Cavernous sinus. A, B, C, L1 to 3, D through K. Oh. Viral. Can't get it. Attachment, insertion, fusion.
Shapeless. Be water, my friend.
Polymixins. Root 1. adenosis. It doesn't affect the offspring, but it can affect the offspring's offspring. Passed on. Let's see. I think you'll be good, but your kids won't be good.
That is to say, the heart is not a part of the body in the sense that a distributor is part of an automobile engine.
And the cytoplasm, rough ER. Oh, it's the rough ER because it's not folding right. These inhibitors causing decrease, elevation. ACE inhibitors can increase creatinine. Does ACE inhibitors decrease your GFR? They do. I'm looking at that. Reverse transcription inhibitors do that transcription out. Creatinine. PKU dihydrate. Oh god, is it Noro or Epic? Norepinephrine. Short and long. Long and short. Damn it. From a gastroduodenal perforated ulcer. Right ventricular and pulmonary artery. Oh, duh. Because oxygenated blood will go into the right ventricle, pumped into the pulmonary artery, and that's going to be oxygen saturated. Okay, that's cool. El resfriado.
El resfriado.
What were the exceptions? If you have a prior infection, or a known prior or a known current infection, because prophylaxis is already, or empirically, they're empirically current prior. Okay. Sonic the Hedgehog. Why I can't remember that. Okay, this is A over C divided by B over D, or A times D over C times B. C divided. Genetic deficiency of FOXP3, and I don't know what that is. dysregulation. Ceftriaxone, ceftazidime, cefotoxin. Decreased libido and anorgasm. And affected population at risk. Not know my biostats. Excellent.
だけどそれ以上に育っていって環境がそうさせてしまう。だから今は受け入れられる病気かな。
Acetylcholine, 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 acetylcholine. I don't know. What makes me sound more professional? No. This question is also relevant for stabbing. That's where I originally got this from. Autoimmune alopecia. Yeah. Binding entry. Yeah, it cannot bind salicylic acid. Okay. 0.5, 0.6, and 2/3 of the upper limit. This is diabetes insipidus. Chromaffin cells, yeah. Not temperature and pain? Yes. How did I remember that? Oh, it's like glycine, X-glycine leucine or X-glycine hydroleucine? No. No. I should know this. I literally talked it out like 10 minutes ago. 2 alpha, 1 chains. 1 alpha, 2 chains. There's a 2 chain joke somewhere in there. I need to learn how to speak. Yo, streaming, I don't know how streamers do this. I gotta get better. I gotta up my game. Look, not a single viewer. And we've been going for an hour. No likes. Sad. That's okay. Chikari malformation is Dandy Walker. A band. Oh, I don't know. All right, I am ready to be done with this for now. All right. Stop streaming. And then I guess this is the part where we go to the end of the stream. Oh, I didn't do it. Okay, I don't think I did an end stream scene yet in OBS. All right. Thanks, nobody, for tuning in. But I appreciate myself for getting out here and trying.